Hey there, it's Dr. Cammisa. Welcome back to our video series. And as you can see here behind me, I'm in the traction zone of the office. And today what I'm going to be talking about is our vertebral axial decompression table. I know that's a mouthful, but stay tuned, I got lots to share. If you're new to our channel, please subscribe, hit the subscribe button below, give us a thumbs up, share, turn on your little bell notifications. So stay tuned, this is going to be a fun one. Hey there, it's Dr. Cammisa. Welcome back to our video series. And today we're going to be talking about this table right here, which is a vertebral, meaning the vertebrae, the actual bone, the vertebral axial decompression table. And it's a big piece of equipment. You can see we've got the computer on one side, and the table we can do both lumbar spine and cervical decompression, thoracic decompression. So we have the computer on one side over here, all the way down to the far side over here where it's the end of the table. So it's a large piece of equipment, probably 7 feet in length, something like that. It's a very complex piece of equipment. So I'm going to break it down and really try to explain why we have it, why we use it so much, and what kind of conditions would really benefit from this type of care. So this is going to be a multifaceted video trying to explain this complex piece of equipment. All right, so first of all, you can see them sitting by the computer here for the vertebral axial decompression table. So I guess one of the things I want to talk about is what is the table good for? How does it really work? And then I'm going to show you some video clips, and some video animations of how the table actually works. And then I have my own animation of how the table works. So first of all, what is vertebral axial decompression? So in a nutshell, it is basically we're going to pull apart, we're going to just stretch or distract, decompress, hence the name decompression. We're going to decompress the spine. And what that does, it takes the pressure off the nerves. And I'm going to show you in a second here with the spine. But so what happens is when those nerves get pressure on them, you can get sciatica, you can get pain into the buttocks, you can get numbness and tingling down into the leg, you can get all kinds of different back pain, and it can be also in the neck as well. So it can have pain radiating down either arm, radiating down into the legs either side. You can have, like I said, sciatica, piriformis, lots of different symptoms, but basically, usually it's going to be lumbar spine related symptoms, and then it's going to be neck related symptoms, like from headaches and whiplash and concussions, that kind of stuff. So the table is very versatile. And what I love about this table, it's called the Kennedy decompression table. What I love about it, it allows us to put the patient into 6 different positions depending on which vertebrae, which area we need to focus on. And that's what I love about it. It's so versatile because every patient's a little different. So stay tuned. I'm going to set the table up and show you some things. So here's some of my props. I have a ruler right here. Obviously I have the spine. I have a piece of wood on this side, which would be analogous to your torso, your upper body. I have a piece of wood on this side, which would be your pelvis. I have a spring that's attached to the pelvis all the way up to the torso. And when the table unlocks, let me see if I can get this on video here. When the table unlocks, so there is, you can see the spring moving. And so the table, when it's unlocked, it allows the computer to distract the spine. So I'm going to set it up and put some pressure on there so you can see how it actually moves. So now I got the table, it's being distracted now. I have my ruler here, And so right now, I got the ruler held on the pelvis piece, and I just want you to see, you can see here it's at 16 and a half, 16 and 3/4, 16, we are at 17. I just want you to see that the table is actually distracting apart. And when you're laying on the table, that tension obviously is tailored to each individual. And so what happens, we control how long the pressure is at maximum, how long the pressure is at minimum. And the computer now is going to release that pressure. So you're going to see the number starting to decrease now. At this mark right here, you see it's 17. It's going down, so the table's coming together. And it's going to be held for 5 seconds. I got this obviously from Menards. This is an unsponsored video. Laugh out. Yeah, seriously. So, and then now it's going to, in a few seconds here, it's going to start to load back up and distract the spine again. And you're going to start to see the ruler start to move again. And that's the motion of the table. So you can see here on the image, as the patient is sitting here, that the head is towards the control panel. And as we play the video, you're going to start to see, it's going to zoom into the lumbar, into the cervical spine area, to the neck area. And what's happening is, now you're going to start to see that it's actually distracting or pulling, releasing that pressure into the spine, allowing the energy to flow back through that area. And so it's going to be rated through the computer system. We control how much force is at the maximum amount of pressure and on the least amount of pressure. But we're always trying to get as much pressure as a patient can tolerate that's pain-free. You can see here, so someone is laying on their tummy and they're tethered to the computer system here. And as the computer zooms into the lumbar spine area, we always want to put the patient in the most comfortable position possible. That's why the table is so versatile. And you can see here that now they're on their tummy, that they're getting the greatest amount of relief from the decompression versus if they were on their back or on their side. And so that's one of the advantages of the Kennedy decompression table. We're able to just really fit this, dial it into the patient's needs. So this is probably one of the most common positions that we do. I like to call this a zero gravity position here. And so as we play the video clip here, you're going to start to see, as it zooms into the lumbar spine area, again, you're going to see how the table, when we set up the parameters on the computer system, the table is going to distract the lumbar spine to allow the fluid to get into that area, into the disc, into the joints, decrease the pressure on those nerves, and allow the energy to start to flow back through that area. So if someone has a condition like sciatic, this would be fantastic for that. As you can see on the animation here, we're going to be looking at the joints, or also the facet joints, or also the joints that allow the spine to move properly. As we play the animation, you're going to start to see that when the nerve root on the bottom here is compressed, it turns red. And so as we do the decompression, we're taking that pressure off that inflamed area there and allowing that nerve to have the proper energy, and hence reduce the symptoms of pain going down the leg either side. So what I'm going to show you here as the video plays here, you start to see this area on the left-hand side pressing onto the nerve irritation. So as it increases its degenerative changes, and you see the nerve getting irritated, changing red in this particular case on the left-hand side here, where you get that nerve irritation. So with the decompression, we would be able to reduce that swelling, reduce that inflammation. With the adjustments, allow that disc to be in a better position without the nerve pressure, alleviating the symptoms. In this particular case, this would be like a left sciatic going down, pain going down the left side of the leg, numbness and tingling to the left leg. So you can see here on the animation as it starts to play, we already did the left side, but here's the right side here. And you can see as it starts to approach that nerve, where that disc is bulging or spreading out. Think of a jelly donut spreading out. You start to see that irritation, and then that's when the nerve becomes irritated. So we want to reduce that pressure here, and again, that's one of the benefits of the decompression table. As you can see, this is it's a very complex piece of equipment, but it's so valuable for us. We use this, I don't even know how many times a day we use this on patients. 20, 30, 40 times a day, I don't even know. But I did like my little setup here. I thought that was pretty fun. I had some fun doing that. These are 2x12s, if you're curious what they were. So, but just to give you some examples of, trying to make some fun out of the video, but really just trying to show you that the spine is this dynamic structure. And if we're trying to empower people to live their best day, we need to take that pressure off the spine, allow that energy to travel from our brain down our spinal cord. And if that energy is getting blocked at the neck because of a trauma, a car crash, a whiplash, concussion, whatever that may be, or if it's getting blocked at the lumbar spine where you can't stand up, you got pain down the leg, whatever the situation is, we want to relieve that pressure. So this is another tool in the bag, if you want to call it that. So to allow us to get your spine in the best shape possible so that you can live your best day every day and not just once in a blue moon. So like I said, if you're new to our channel, please subscribe below. This is kind of a complicated video to put together. I hope you like this, and share some of your thoughts below. All right, guys, until next time, stay tuned. I'm Dr. Cammisa, and until next time, we're empowering you to live your best day every day. So have a fantastic day today.